So as we are here today, my name is Charmaine Cooper, and I am overseeing the education as well as the sales support for Dermo28 Canada. Now, our whole goal of you joining us today, either live or joining us at a later time as you're watching this link, by the way, thank you so much, is really to help to give you a little bit of insight to who we are as a brand and give you some insight to the concept of Dermo28. You know, whether you're considering to bring on a complementary line, a secondary line to add to what you already offer your clients, or whether you are, just thinking about having a primary line, Dermo28 can support you in that. You might also just be watching today out of curiosity, just trying to get a little bit of an insight to who we are, and that's completely understandable as well. No matter what your reason for joining this webinar or watching this link, I want to encourage you that you can certainly reach out to me, and I'll be popping up a slide at the very end of our portion to show you our contact information, email, and contact number, and I'd love to follow up in more detail for you. But today's format is more of a generic overview to introduce you to who we are. And the format today does not facilitate live chats. And the reason being is that we just really want to introduce to you the concept of who we are in the form of an info session. So if you do have questions, feel free to note them down and email them to me, or even follow up with me with the contact information. I'm definitely available to assist you in any way, shape, or form. So just to let you know how today is going to look, we are going to be starting off by going into a generic overview of our collections, who we are as a brand, why Dermo28 even exists, and we're going to end off with a very short mini demonstration. Now, the demonstration, we're just going to highlight only one segment of our full protocol of one of our many protocols that we offer, and that's really isolating the peels and how Dermo28 gives you a unique approach with the peels. If you are a professional skin therapist, that might be of interest to you, but please also be aware that we do offer specific webinars to skin therapists every month. Today is more of an info session. So if you're an owner, a spa director, and maybe the demo is not something that's going to interest you per se, you might want to bring your team on to note that at the very end. But that's only a small portion, but I'll give you more detail about how your skin therapist can have more ongoing free complimentary webinars available should you choose Dermo28. Okay, so without further ado, let's jump on in and let's talk why we exist. You know, the standard of excellence and integrity and elegance really is a European standard. So Dermo28 was inspired, created, developed by a team of professionals in Italy. And this team consists of dermatologists, chemists, skin professionals, marketing specialists, I mean, the list goes on. And they've come together, and our research and development laboratories is actually located on site of the University of L'Aquila in Italy, in Bologna. So there we have a Dermo28 team of scientists and professionals that are committed to delivering potent concentrations, and these are cosmeceutical active ingredients that really deliver results for the skin. Cosmeceutical meaning that they alter and enhance the structural integrity of your client's skin while improving the cosmetics of it, the appearance. With that, we know that the European standards obviously made this law years ago. No animal testing, no animal ingredients, and all of our testing is done in accordance with European legislation. Our testing is done on people. So with that being said, let us kind of let you know how long we've been in existence. Dermo28 has been around and founded since 1995 by that team of professionals that I mentioned to you earlier. Again, with the commitment to deliver results for the skin therapist, because we want the skin professional in the treatment room to be confident that what you're using on your clients are going to yield results. I've got some before and after pictures coming up soon to show you as well. And obviously to also enhance and augment the confidence of your clients in your professional recommendation, in your professionalism, and in the products that you send them home with. Now, Dermo28, as you may have guessed, dermo meaning skin, and 28, speaking of the ideal rate in which cells turn over, really is based upon the philosophy of cell renewal. So if you are not 28 years old, your cell renewal is probably not 28 days. So we get that as a company. So if you've got a younger client, or extremely or more mature client, the cells renew a lot slower. So Dermo28's concept being based on cell renewal helps to ensure that that rate for whatever age they are is idealized and is functioning as it ought to. So in other words, Dermo28 can be used by every age, every skin type, and every skin concern. Very simply put, Dermo28 has a method. Not going to test you on it, but it's there before you, so simple to remember. Number one, as I briefly mentioned, cell renewal. Pretty much all of our complexes have either acids or ingredients, cosmeceutical ingredients, to expedite the natural renewal of the skin. Because when the skin is renewing, you'd be surprised how the skin can self-regulate and take care of its own problems. But we've got some other assisting formulations as well to throw in there also. Number two, pH balance and hydration is essential, everyone, for optimizing a suitable environment in which the skin can thrive, in which your formulations can work, in which acids can be most effective. The more dehydrated the skin, the more resistant the skin. The more hydrated the skin, the more receptive it is to whatever formulations that you use. We get that, and we're very passionate of ensuring that the skin's health is not compromised, but it's optimized. And number three, a collection range, as I'm going to show you momentarily, that is efficacious, will deliver the results confidently. So let's go ahead and introduce you to the collection, shall we? Our range is quite extensive, as you can see in this slide. As you meet the ranges, I'm just going to give you an overview of some of the key ingredients, otherwise we'd be here all day. So I'm just going to highlight some of our key properties of our key systems. And as you can see, whether it's early signs of aging, normal combination skin, moderate to severe acne, damaged skin in terms of sun damage and chronological age, whatever the case may be, Dermo28 has an extensive range in retail as well as in professional, because we believe that a professional treatment is left incomplete unless we've sent the client home with products to reflect healthy choices and to not undo everything that you've achieved in the treatment room. So again, whether you are a Medi Spa, a day spa, a sole ownership, or renting a room, we are able to deliver results with the Dermo28 lineup. Let's go ahead and categorize them for you in different categories so we don't bombard you with all of the systems at once. In our aging category, so to treat aging concerns, we've got the following. Pro-Age. Pro-Age is indicated by your orange and white. And it is, if you kind of look at it this way, more of a proactive position in aging. So your earliest signs of aging, the clients that are starting to be a little bit concerned, not marked full signs of aging, so you don't necessarily want to go with your strong anti-aging line for them, but this is your early signs of aging. We've got ingredients like lecithin, which restores the intercellular lipids. I'll tell you what starts to go for someone who's just starting to age or starting to notice those fine lines starting to appear. It's the lipid content. It's the dehydration. They're going to start to see more dehydrated lines in the skin. So lecithin is phenomenal for that. Urea encourages microcirculation, and cellular oxygenation gives that skin a boost, more like a refreshing and a radiance again, helps to maintain that. And we always believe here at Dermo28 that prevention is the better angle than correction. Yes, we've got properties to correct, but if you can do a preventative measure, you've got your client at an advantage. Methylamine methylamide, excuse me, cellulose gum is a phenomenal stimulant for collagen. It also locks in moisture and sustains that moisture throughout the day, even when other moisture is starting to evaporate. This helps to keep the skin conditioned, and at the same time, it's stimulating your collagen production, those early fibers that are starting to depreciate as we get a little bit older. There you have our Proage available for you. Our next category is called Nutriage. This is for nutrients that we deliver to the skin, and it's indicated by your purple and white. Available in professional as well as a full range of retail formulations. I like to call this your plumping line, your volumizing line. Clients that have used this, they have literally come to us and they've said, my skin feels voluminous, and that's really what it is. So it's perfect to position as you're in between your injection services for your clients. You offer your Botox, your hyaluronic acid injections. This is the formula, helps to sustain and helps to complement your procedures in that category. Now, it also has your plant stem cells, which is your Malus domestica, and that is essential in collagen and elastin fibers being produced. Love, love, love the stem cell technology. That's available only in your Nutriage. Saccharides isomatrate, and this is deeply nourishing as well as, remember we said the nutrients being delivered, it's nourishing and hydrating. So you'll find amongst all of the collections in Dermo28, Nutriage is the most emollient. Note, I didn't say greasy because it's never greasy. Who wants to feel greasy on their skin, but is the most emollient on their skin. And it really helps to condition. It's perfect as the winter regimen or the evening regimen. Remember, it's for moderate to even fully or deeper wrinkles. It is your wrinkle treatment system and collection. I love the argan oil because it nourishes and firms. Now, if there's inflammation in the skin, which in aging skin obviously is manifesting inflammation, what is that? It is glycation. It's an advanced glycation that's starting to degrade the collagen and the elastin fibers. So arganian oil is nourishing and healing. It helps to diffuse the inflammation that's causing the expedition of the aging within the dermis, therefore showing up in the epidermis. Love, love, love the Nutriage line, and that is an option with our myriad of collections as well. I want to show you a before and after picture, however, because seeing is believing, correct? And I do want to note that all the pictures that I will be showing you are completely untouched. So this client here has had a treatment with Nutriage, for 28 days. She's been using home care as well as professional. So you can see the improvement in the skin. I mean, it's notable and it's undeniable here. With that being said, let's go to our next collection. This is Unica. So this speaks of the unique approach to treating 360 degrees of aging in the skin. Now we're able to do that by addressing manifestations of chronological aging, manifestations of environmental aging, that's huge obviously, and manifestations of hormonal aging as well. So we can help to really fundamentally restore, repair, promote what the skin has, through damage, stopped producing. And that's with our matrikines. Fundamental peptide, chains of amino acids for you skin therapists there, you got this, you know it. And it helps to repair and build collagen and elastin. Stabilize vitamin C, we got to stabilize it because vitamin C is the most unstable vitamin amongst vitamin A as well to use, especially in skincare formulations. So we're very, very nitpicky about ensuring the quality of our vitamin C, and it's all stabilized. We've thrown in your glycolic, salicylic, and lactic acid to renew and exfoliate. By the way, I'm just listing some of the ingredients. We've got hydroxy acids in your Nutriage as well and your other systems, but I'm just giving you a few. And yeast extract I love because it's nourishing as well as soothing. You've got to soothe that skin that's showing marked signs of aging. Unica, phenomenal. Let's take a look at the before and after picture here as well. This client that you're seeing, focus in on the upper picture and focus in on the below picture. The below is the after. So 28 days of use, professional as well as your retail, and you can see that that unique hyperpigmentation that started to accumulate as a result of age, environment, stress even. I'll tell you, stress like nothing else can cause manifestation of hyperpigmentation on your client's skin. You see this every day. So Unica gives the results. With that, let's continue on to our next category. We covered Pro-Age, Nutriage, and Unica to address our skin aging, whether it's early signs, deep signs, or damaged skin. Now we're going to cover our dehydrated and combination concerns. And we've got to start off with aqua. You know aqua means water. So this is like a drink of water for skin that's thirsty. Who isn't thirsty? So pretty much aqua is for all of your clients. It's for all combination skin, offering glycolic and mandelic acids to exfoliate and hydrate and cell renew. Hyaluronic acid is a no-brainer, holds 1,000 times its own weight in water. Vitamin E and vitamin A together, you may already know this, but when you put these vitamins together, they both synergistically enhance and boost one another's function. So this is a great antioxidant, and it also helps to improve the health and overall constitution of the skin. You'll see this in my before and after, which is coming up shortly. And of course, we had to put peptides in there to stimulate collagen production. Love the fact that your clients who are also concerned with aging can definitely use aqua and will see results in your professional as well as your retail range, as you can see. This client you're seeing has used it, again, pictures completely untouched, for 28 days, professional care as well as your home care as well. Look at her improved radiance. Look at her improved lipid content without it feeling heavy, and look at the evenness in her skin. So aqua really is sustainable results and efficacy delivered in the skin. Our Illumina is another one of my favorite collections because it speaks to my major concern, which is pigmentation. So we live, and if you're in the Toronto area or in your immediate area that you work in, you probably noticed that we live in a multicultural society, which is wonderful. But we're seeing all skin tones, all skin shades, all mixtures of skin conditions. And Dermo28 is passionate about using a brightening and illuminating line. We don't use bleach. We don't believe in using the hydroquinone because that is a different approach from what our position is, optimizing skin health. Check it out. We've got niacinamide, vitamin P, absolutely essential in treating pigmentation. I'm talking hyperpigmentation, not the hypopigmentation as you know, but extra pigment that's being produced in the skin usually can be traced back to sensitivity, can be traced back to irritation, glycation in the skin. So this is also going to treat your aging concerns. And this is melanin inhibiting. So it helps to prevent the trigger factor that causes the pigment to be produced. Lactic acid, love it because it's hydrating, and it also exfoliates as well as it inhibits the tyrosinase enzyme. If you look at the next ingredient combo, you'll see bearberry, which also inhibits the tyrosinase enzyme. That's what's responsible. It's a complex condition. It's responsible for causing the cells to pigment. But white mulberry, which is its partner in crime, also not inhibits tyrosinase. It keeps a tyrosine in an inactive state. Because when you're stressed, when you go out in the sun, when you've cottaged a little bit too long by the water, you are activating tyrosinase. So the tyrosine, which is the root, is protected and shielded by mulberry, white mulberry, so it doesn't activate. So here you're seeing preventative as well as corrective. Vitamin C, it's a no-brainer, it brightens the skin and builds collagen. So love the before and after here. With pigmentation, as you know and you already share, I'm sure, with your clientele, you've got to be careful with claiming to reverse everything. So obviously there's a history. We've got to have an extensive consultation. We train this with our skin therapists in our webinars and ongoing training. But we like to say you want to give the skin at least 6 weeks to start seeing results. Some see it sooner, and some see it around that 6-week mark, 6 to 8 weeks. But you can see the improvement is undeniable here as well. This client, untouched completely again, is at the 6-week mark. We also offer our youth collection. Now, everyone, this is only a complimentary collection available in retail only, but so worthwhile. It has the maximum amount of hyaluronic acid over all of Dermo28 collections. Wild Rose, also known as Winter of Rose, stimulates collagen, and it's a natural cell renewal, not an acid, but it helps those cells to renew at a natural rate. And polysaccharides really lock in that moisture and sustains it throughout the day, kind of like what we talked about in Pro-Age. So when the skin naturally starts to have that transepidermal water loss, your polysaccharides are going to kick into extra gear there to really ensure that that is locked and loaded into the skin. Amazing complementing enhancement to whatever your client's heart or foundational regimen might be in as well. Youth is absolutely amazing. Now in our last category, you were waiting for, and I know, we have to talk about our inflammatory disorders. That's a major concern that you're seeing coming into your clinics, into your spas, and dealing on a regular basis, no matter what time of the year it is. So our first one to deal with inflammatory and infectious skin disorders is pura. Pura stands for your purifying or your purification that delivers to the skin. And it is for all forms of acne. I'm talking whether you're dealing with teenage acne, adult acne, stress-induced acne. We've got spot treatments all the way through to a full regime. And our key ingredients, just some to name, Laminaria saccharina, which is pretty much your iodine and your potassium. It oxygenates the skin. You know this when you're looking at your client's skin in the treatment bed. When that skin is clogged, when the oxygen is not able to purify that follicle, it congests and it gets thick and the oil accumulates and the bacteria just starts to swell that skin. So we want to oxygenate, give it that life, and reduce sebum production. So we not only sop up the oils, it's not just a sopping up, but it's preventing the extra production of erratic oil production, which is great and great news for your client. We want to hydrate the skin. Don't ever want to rob the skin of hydration. So that's going to ensure that the skin self-regulates. Salicylic acid, triple threat acid, as you know, is a beta hydroxy, anti-inflammatory, antibacterial, and it also likes to find where the oil is hiding down the mouth of that follicle. And here my favorite ingredient is again, niacinamide. By the way, it's anti-aging and it's such a multifaceted ingredient. Reduces enlarged pores and it helps to heal, preventing and healing post-inflammatory hyperpigmentation. That's your acne scarring. With regular use, professional treatments as well, your clients will see results. And then we have our Comfort. And the packaging here is your pink and white. And Comfort just speaks to turning down the degrees of redness and irritation in the skin. An intolerant skin with regular use of your Comfort can become stronger, can become more fortified, more resistant to intolerance, and become more tolerant itself. Calendula officinalis, soothing, protective, moisturizing. Arganian oil, obviously, for enriched ceramides, because every time your skin is inflamed or red, something is up with the barrier. It's dehydrated. There's a compromising of the barrier. So we want to ensure that those key lipids are redelivered to the skin to reinforce the skin's barrier. Argan oil does that and it heals. And ruscus extract is going to strengthen the capillary walls to constrict them. Instead of causing them to get dilated and give you that flushing and blushing, it constricts. There's so many other ingredients that I could go on in the comfort system, professionally as well as your retail. And we're not afraid to throw in your acids in here at a minute level to act as a vehicle to bring in those active healing properties into the deeper layers of the skin. Let's look at some before and after. I know you're waiting for that. Here you can see this gentleman. Everyone, I'm telling you, this was one treatment. This was a professional treatment that he came for. And we used our professional therapy treatment. I'm going to be showing you the therapy treatment shortly when I do my mini demonstration. And this was our therapy peel hybrid that we used in the comfort line on this client. There's another picture I didn't have time to put in here, but it showed his hairline with psoriasis, and it extremely subsided. This is the line for your eczema clients, psoriasis, any form of dermatitis, any type of ichthyosis, any type of irritation. Even if you've got an acneic client that the anger of the acne is just out of hand, throw them into comfort first. Calm and reduce the redness. Shift them into pura afterwards. And here is another client after 28 days of consistent use, professional treatments, as well as your retail. You can see the rosiness within her nose wing area, tip of her nose and the chin have wonderfully reduced. And the radiance, look at that, the radiance has improved in her skin as well. Well, those were our lineups in terms of our collections. But what I want to finish off by before we shift into our quick little demo is really to highlight for you some of our unique heroes. I mean, if I could really rephrase it, all of our formulas are heroes. But we have some heart products that really have championed results that are translatable no matter who you're working on, what condition, what skin concern, or what service you're offering. So I wanted to take a few moments just to highlight a few, as great as all of them are. So to begin with, available in professional as well as in retail, we have our pre-treatment heroes. This is called your dynamic duo. And if I could show you, you've got it there, but it's called your crema acida. And this is your acid balancing cream, as you can see. I hope you can see that in the lighting there. Your crema acida, which is available professional as well as retail. And its partner in crime, your regulatora pH, or your pH regulator. And that is not just a toner, it actually helps to idealize the pH mantle of the skin. We actually trained this webinar for our skin therapists, and we went into a lot more detail on why this is so important and the acid balance of the skin. Everything in Dermo28 is based upon this premise. So these two together will optimize your results, your skin results, for the professional skin therapist, on your clients, and at home every time. And you never want to leave your home without it. Literally using this treatment sets the platform, puts out the red carpet to deliver maximum efficacious results in your client's skin. So we also have a great introduction for you for our peels. In Dermo28, we have two phenomenal vital peels. So your Vita Peel #1 is at a glycolic of a percentage of glycolic of 20% at a pH of 3.5. Now it's interesting because you'll see me use this on Katie actually. Our peels have many other ingredients that I couldn't put on this slide. Obviously, this is just intro, but it's a viscosity that is easily controllable in terms of its delivery into the skin, which means the quicker an acid permeates, yes, your client's going to feel it. And there are great lines out there that have that approach. But Dermo28's approach is we want to keep it on the skin as long as we can. And the viscosity, which is more of a gel texture, allows us for controlled delivery. It also hydrates, conditions. And you're thinking, hydrate, condition, don't we want to kind of remove all of that from the skin? Well, not in this particular formulation, because we prepare the skin. The skin is receptive. Now we want to make sure that the skin's receiving it. And we give it that category of about up to 12 minutes for maximum results. Down below, you've got your VitaPeel Plus. Now here we have a stronger formulation at a pH of 3.0, a little bit lower, glycolic, lactic, and salicylic acid blend. There's also retinol that we throw in here. There's also your conditioning vitamin E. There's other ingredients, but again, when you see me using it on Katie, you'll see that it's a thicker viscosity, allowing slower, controlled delivery because we want it to do what it can do. And the longer it's on the skin, the better the results we'll see. But we want to kind of, progress our clients slowly. Now, we also have another category of peels to offer. Amongst many others, we call these our professional peel therapies, where it's a hybrid of a peel and a therapy. Well, why is that important? We just talked about VitaPeel. Well, we are approaching it from a layering approach. And we offer it in all of the systems and collections that I pretty much walked you through, except for Pro-Age. So we have your professional aqua therapy for combination skin, which I'll be using on my model today. Your professional Illumina therapy, phenomenal results. Professional comfort therapy, yes, we've got glycolic in here. Your professional wrinkle therapy is the only one with no acids. And we spent time training professional skin therapists on why that is, because we really want to infuse the skin with nourishment. It is the plumping line, the volumizing line. And here's our professional therapy to do that. And we have our Unica, remember, damaged skin, 360 degrees of damage on the skin. And this got 3 sachets there. And also, last but certainly not least, your Pro Pura therapy for your acne lesions. I'm talking someone who's considering, should I go see a dermatologist? Should I consider going on Accutane? And they're thinking that, and they want to know, do you have something that I could consider before I make this decision? Or maybe they want to cycle off of that, but they need something to maintain. Pura is absolutely highly efficacious in the results. And the beauty about this, everyone, is that Dermo28's position is that you can layer them. You can change up the order. They all have sachets, as you might be able to see on my right here. They all have sachets, and the sachets must be used together. Now, in each of the boxes, you got 20 treatments, so 20 sachets worth. And that's for great results. And I'll be using my aqua, as I mentioned, on my model momentarily. But you can start them off with a lower, which is the Pro therapies, because they don't have as strong acids or as low a pH as the VitaPeel, or you could start them off with the VitaPeel. Either way, you've got options. And again, we offer a full gamut of training to show you how to really achieve that. But of course, we can't skip defatting the skin. So Dermo28 offers a non-compromising skin degreaser called Prepping Formula. Again, it also has salicylic acid. It has your astringents, not your specially denatured alcohols, but it has your astringents that will not compromise the skin's health, but it will effectively defat the skin while leaving it conditioned. Remember what I said. The drier skin is, you know this, the more dehydrated it is, the more resistant it is. So we don't want to degrease and make it tight and make it resistant. We want it to be conditioned but degreased so that it's going to receive the acids readily. And we're able to achieve that by using our prepping formula. And coming to the close here, we also have myriad of options for your device treatments, your modality formulations, yield great results like our conductive gel for all face and all of your body, electroaesthetic treatments. They are lipid substances readily available to be delivered into the stratum corneum to facilitate your modality movements and your modality goals within the skin, no matter what you're using. So conditioning, but no residue or grease leaving formula. And of course, we have our super highly concentrated serum. All of our complexes in Dermo28 are called serums. And this is your cozyme complex, which is your coenzymes. That's why it's cozyme complex. And it promotes dermal as well as epidermal reconstruction and healing. So this restructures, rebuilds, perfect after your, even your puncturing treatments and your needling treatments and procedures. This is fantastic to help to restructure and rebuild the integrity of the skin and those vital vitamins. And lastly, one more hero, as you do more invasive procedures or procedures that can enhance the redness or inflammation in the skin, controlled wounding, shall we say it that way, we have available in professional as well as in your retail soothing formula. Soothing formula, so here I've got my professional available, so you can see in the picture you're seeing the retail. It's a larger size, so professional skin therapists can use this as well as your clients at home. It is not a moisturizer, but you apply it to your finger and you apply it to the tender areas, the raw areas, the areas that may be more inclined to peeling or frosting, and you just focus on those areas that you notice that client is a little bit more intolerant until that skin has time to regenerate and heal itself. So that's the beauty of that as well. So with that being said, we've covered a lot in our short time together. You've been so patient. Dermo28 Skin Solutions, we have offerings for you. Again, professional and retail collection range for every skin concern. I did not and could not have had time to go into everything, but just as an overview, you were able to see some key ingredients to be able to address that. We have pre and also offer post care for all medical procedures, all invasive procedures, and we also have your conducting formulations throughout certain modality procedures as well. Cosmeceutical grade actives, as we mentioned, to support and achieve the professional skin therapist goals, because you got goals, as well as your clients' goals as well. So what do we offer to you? For partnership, and we would love to partner with you, and again, this is an obligation-free webinar and link, so this is something that maybe you're thinking about. But I want to share with you the partnership offerings that we do offer. Completely customizable Dermo28 product ordering. So that means if you're interested in the stem cell technology, and maybe you have a line that kind of addresses in a way that you feel comfortable with for your brightening, you can customize that. We can work that with you as well. So there is no limit. There is no minimum order. We completely, on your one-on-one basis, we can work out a customizable agreement with you for what you need for your skin professional clinic as well as for your clients. Comprehensive training for all your staff, for you if you are a professional, and that's on-site, hands-on training available. And that would be worked out if you are in the GTA area, the Toronto area in particular for now, and then we can look at extending that as needs arise. And of course, monthly webinar training options for all skin concerns. We focus on all topics, retailing, business support topics, and Dermo28 formulations. We have protocols that we make available for you. Every collection has its own protocol, and they're completely available. So we would love to partner with you. And again, it's perfect possibly as a complementary line, or if you're thinking of a primary line. Dermo28 has solid options for you. Finally, if you were itching and you couldn't get to me and you wanted to ask some questions, or you had a question about any of the content that we covered, I welcome all of your questions, inquiries, or even a further discussion if you'd like, or I can send you further information. And my contact information is Charmaine at dermo28.ca. That's Charmaine at dermo28.ca. And our Instagram handle is there for you as well. But if you need to contact me by phone or leave a message and I'll follow back by calling you, obviously, I can be reached at 416-747-6439. 416-747-6439. And I would love to connect with you. So this is Katie. I have already taken the time because I knew we were going to be doing our treatment with the recording today. I've already taken the time to cleanse her skin. I've prepped her skin. Remember, we had our fantastic ingredient formulation, the dynamic duo, that really helps to maximize and optimize the result in our treatment. I was able to already do that. That was our crema acida as well as our pH regulator. That way our skin, her skin, is that much more readily receptive for the peels. So her concern has been a little bit of sun damage, and I know that I've had a previous consultation with Katie already, and her concern has been early signs of aging. She's a young client, but she spends time outdoors, like many of your clients do as well. And cottage country is one of her favorite pastimes. So what I'm going to be doing is I have already prepped her skin, as I mentioned, and I'm going to now prep it for the peel. So we're going to be using our prepping formula, as I showed earlier on. And to do that, I'm just going to go ahead and take my cotton gauze or cotton pads, whatever you use at your skin center. And it's just a quick watery solution that is delivering salicylic acid to the skin. It's also taking the time to ensure that the skin is not compromised and stripped of all of its key moisture. It's just defatting the skin. So I'm just quickly wiping it onto the skin. It's also going to help to ensure that the skin has that conditioning element still within it. And I like to take it all the way down to the chest as well. And it's simple, 30 seconds to apply onto the skin. With that being said, we are now ready to go into the use of our VitaPeel. Now, whether you use gloves or not, here at Dermo28, we train and we actually support whatever your comfortable level is of using acids. Obviously, if you're doing treatments and you're using acids regularly, back to back, you want to protect your hands. But as skin therapists, as skin professionals, we know that we really love to ensure hand-to-hand contact. So I've just put my gloves on to show if that's something that you do. Absolutely, to continue doing that. But it's absolutely fine to remove your gloves as well. And I'm going to show you why that is shortly, because I'm taking my VitaPeel, as I mentioned I was going to be using. She doesn't have advanced signs of aging, so I'm not going to go with my VitaPeel Plus. This is my 20% glycolic acid. And I want to show you, oh, I've locked it. I want to show you how more of a gel formula it is, as I mentioned. So you can see it's more of a gel formulation. So it's not a watery formulation that swiftly absorbs into the skin and could be very and highly active, be uncomfortable for the client as well. It is more of a viscous texture that allows us easy control. So if you have your long Q-tips, we advise it's great to use it with that, or you can even use a bundle of 4 Q-tips like I just took here. Notice I haven't covered her eyes. Because this is a gel and it's not going to be running all over Katie's skin, I'm completely fine to leave her eyes uncovered because I've got control. I like to start, as many of you probably do, I like to start with my peels in the clavicle area. The chest area is usually highly exposed to the environment. It could be more dehydrated as well. And I like to touch base with my client and find out how she's doing. Katie, how is the level of activity on the chest and the neck? On a scale of 1 to 10, what would you say?
Like a 1 or 2.
1 or 2. And that's primarily, you know, normal as well. Many clients, again, at a VitaPeel level, they don't really feel any activity. Some people might, some may. So it all depends on the level of dehydration and the level of exposure to professional treatment. So some may not. You'll notice I jumped to the forehead now. So we like to also go to the bonier areas of the face first, less flesh, because if there's dehydration, this is likely a common area she'll feel it as well. From there, I will make my way down to the T-zone. Katie, we're cool with that?
Yep.
Yeah, any activity, minor or?
Very minor.
Very minor, okay. she promised me to be really good with her SPF. So I'm so appreciative of that. So I'm also taking this around her mouth and completing the T-zone. As you know, everyone, in your treatments, when you're doing treatments or peels around the mouth area, that's where we have highly concentrated sebaceous glands. So that's where it can pull the acid down quicker, and a client could be susceptible to peeling, frosting, and more activity there. So I like to leave the cheeks for last, as you probably would remember skin professionals in your training, because that's where we have more of the higher concentration of flesh, dehydration as well, and tenderness can come rather quickly if we're not careful. Katie, how is the cheeks at this point?
Cheeks are good.
Cheeks are good? Okay. So again, I am working this on the skin. In Dermo28, we don't consider passes. We don't need to do the passes. And I don't need to just do this once, which means I couldn't go over it again and now it's going to intensify. I can use the whole formula and just keep doing light pressure, no stimulation, all around the skin. I like to use my whole acid that I just pumped out for her in the neck, beneath the chin as well. Now, we like to leave this on for a minimum of 4 to 5 minutes for low tolerance skin. So let's say you're working on a client that has never really had a peel before. You might want to respectfully gauge her skin and see that at that mark of 4 to 5 minutes. But if they're regular, they use their peels, they're very comfortable with peels, you might want to go ahead and stretch that right out to 10 to 12 minutes. If you're using the VitaPeel Plus now, you've got a client that you have progressed and graduated to the more advanced level, you can definitely see further results by using the VitaPeel Plus, higher percentage acids, more acids, lower pH. And you'll notice my gloves now are coming in handy because I'm just moving it around very gently on the skin. Again, no stimulation. And if she's got activity anywhere in particular, she did mention a little bit, 1 to 2 on the chest, a little bit on the forehead. My touch can kind of help to soothe that, but nothing heavy and stimulation wise. So because it's the nature of a demonstration today, I'm not going to keep it on for those full minutes, but I did want to show you how we apply it. And to rinse, obviously we're going to use our cool water, cool tepid water, not steam towels here in this particular instance, because we want to ensure that if there's any heat that was activated in the skin, we're able to cool it down. So I've got my fresh water here ready to go. And I'm just going to make sure that I rinse the skin. We like to say 3 to 4 times. If in doubt, go in that 4th time. You always want to ensure that you have rinsed off the peel. We don't have a deactivator within Dermo28 because within the pH scale, our pure water is able to neutralize it fine. So we want to pick up our pace and work a little bit quicker, because once we add water to the content, as you may recall with whatever peels you have used as well, it thins out the concentration and it could start to absorb a lot quicker. So just as long as your client knows that, as you have practiced obviously in your treatments, there's no need for panic. It's interesting because once a client starts to panic, it actually surges the insulin levels up in the body, and the stress level can actually cause the skin to be more irritated, which means it's going to be more red, more inflamed, more reactive. So always watch our wording, and we like to ensure that we complement that by just letting the client know or preempt what we're going to be doing ahead of time. So I would have let Katie know that I want to ensure that we remove it properly, and I'm going to be using our water just to rinse. Usually a client is not asleep at this phase of the treatment. I can't remember the last time I've had a peel on a client when I've been doing a peel and they've fallen asleep. It's possible. But usually they're aware of the activity on the skin, or if there will be activity. So it's good to kind of use your words, use your professionalism, use your guidance to help to further encourage confidence and comfort within their constitution. So that's 3 rinses, and I have removed my VitaPeel. Now, I also wanted to tell you, as I mentioned, I was going to use for Katie our Aqua Peel Therapy. So you'll see that I'm implementing the layering approach in one way. There's many ways I can do that. I could use any of these based upon the concerns, whether it's unica, aging, sensitive skin, pigmentation, you name it. I will use the appropriate packaging together. So for combination skin, and she has early signs of aging, nothing to write home about, I'm just going to go ahead and dispense my pouch number 1, which is my pouch of acids, bioactives and acids. And then I'm going to also put my pouch number 2, make sure this is here, stable, which is my emulsions. That's the therapy. So the two together are activated upon application. That's the beauty of this formulation. You activate them upon application, and you've got 20 applications to work with. And it should be used in the full treatment. It's nothing that you would use for more than one client. And the beauty about this is that it's so simple, you apply it on like a mask. So simplicity doesn't mean ineffective. Simple means straightforward, no rocket science, but I'll tell you, it yields results in the skin. So because we have already applied the VitaPeel and we've already really achieved great results by keeping it on probably that, 12-minute maximum with Katie, because I know that she could handle it. But whatever timeline or time frame that you worked with on that client, the outer layers of the skin have already been renewed or really gently removed and conditioned. Remember, our whole approach is optimizing skin health, never compromising the health of the skin. So what do you do when you apply this on like a mask? It's already done. You simply go ahead and add value to the client's treatment. Maybe your shoulder massage. Maybe it's something that you can really use to really help to promote and induce further relaxation. So obviously today we're just going to fast forward. I would have had the mask on. You can see it went on pretty almost translucent. It wasn't a heavy mask. We do have masks. We have a full range and collection of masks within Dermo28. But this is all before that. This is all another category. So with that being said, we're going to go ahead now and rinse off her mask, which is her therapy peel mask per se. Now, obviously in our peels, we don't want to use our steam towels. So again, I've now provided tepid water as well. And if you do your towels in your clinics, or if that's something that you set up for your team or yourself, you're comfortable with that, remember, just consider going with maybe your room temperature towels. No hot towel cabbie, because we want to remove heat from the skin if there was any to begin with. And also what we want to do is we want to ensure that the skin is completely rinsed, but never more compromised in terms of irritation or redness than we can control. The beauty about using our acids, as we all know, is the controlled wounding or controlled injury helps that skin to start to promote its own strength, helps it to fight back. And that's where we can see great results with our clients. So just want to do one quick little follow-up rinse to ensure that we have completely removed everything. And from here, because our water always does shift the pH mantle of the skin closer towards your alkalinity, we're going to go ahead and use our toners, because all of our concepts are based upon optimizing your pH as well as your hydration. So for the use of our pH balancing, we would use our toners. We have multiple toners to choose from. Again, time would not have permitted me going through all of our products that we offer, but just our range. So that actually concludes our time together today. And I just wanted to begin by just reiterating again, your time is valuable. We appreciate the time that you took to click on the link. If you're still with us watching this as a professional or even as an owner, my contact information again is Charmaine@dermo28.ca. You may need time to think about it. Our website is dermo28.ca. check us out on Instagram as well. And again, you can always contact me either by phone, as I had mentioned earlier, or by email. Thank you so much for your time, and we certainly hope to connect with you again soon. Have a wonderful rest of your day.